Thank you, Dr. Garvey, for inviting us to Garvey Vascular Specialists. And what I want to do is basically define the difference of your practice, your positioning in the market, definitely discuss historically how we got to this point and your success. So with the start of that, let's talk about the difference of your practice. What does specialist really mean to you?
Being a vascular specialist means that I have specialized knowledge and expertise in the area of vascular disease. It means that if I, quotes, advertise myself as such, a patient can expect excellence in the area of diagnosis and treatment and, generally speaking, information relative to vascular diseases. That, in some sense, has been my adult life work in terms of my career. And I've been through different phases. I've spent much of that time really on Long Island since the 70s. So I've been in this location for a long period of time. I'm known to most of the doctors and many patients that I've treated over the years. And I've been affiliated with Long Island Jewish Hospital and North Shore Hospital in the capacity of both a cardiac surgeon and a vascular surgeon. I was acting chief at Long Island Jewish Hospital for cardiac surgery for several years. Then moved into the area of the treatment specifically of vascular diseases. And I've been doing that, I would say, successfully and also consistently for the last 25, 30 years.
Now, with over 40 million people with venous insufficiencies and only about 2 to 3% being treated, do you feel like this is a lack of education, or is it just because possibly the technology is so new?
Vascular disease is extensive, and it's sort of endemic in terms of the human species because we decided to get up on our hind legs, and that of course makes gravity works against us in terms of our veins. So that is very extensive in the population generally. It has not been according the proper status in terms of attention to treatment. I think one of the reasons for that is that it's by and large a disease of women. And women's diseases and women in general have been placed at a lower level, shall we say, than men and the diseases of men. Recently, the status of women in our society has changed, and with that, the status of their problems has changed. As you know, breast cancer now is something that everybody's aware of the problems of breast cancer. This has not extended so far extensively to venous insufficiency, which is much more widespread. And while it may not cause us fatal consequences as often, certainly causes significant discomfort and functional disability over time. And also there are cosmetic problems as well. A large proportion of the disease, or people with the disease, have not really been treated. And a lot of this has been due to lack of information as well as misinformation. And the fact, too, that many doctors, particularly the older school, shall we say, a woman or a patient would say, you know, doc, I have this problem in my legs, or I have these veins. You say, don't worry about it, it's not going to kill you, and poo-poo it, and then not refer to a specialist. So that I think very often the patient has to take matters into their own hands and insist that they want treatment and insist that they be referred for treatment. And this is a part of the educational need that people like myself and the Phlebology Foundation, which is a foundation that is dedicated to the treatment of venous disease, this is the challenge that we have really to inform the public and to offer them expert treatment.
Is it a technology-driven industry? I mean, just because, I don't want to say the invention of the laser, but how the laser is now used and radio frequency is used, and as of like the last 7 years, for example, you have vein practices all over the country. Do you feel like that is the catalyst for growth?
Well, I think there are two things happening. One is the awareness of people and the desire to treat this disease. On the other hand, there is the greater ease with which it can be treated. Previously, treating venous insufficiency very often required a surgical treatment, such as ligation and stripping of varicose veins, or high ligation of greater saphenous vein, which would require hospitalization and absence from work for long periods of time, sometimes in excess of a week, and significant discomfort over that period of time. Nowadays, can be treated relatively easily as an in-office procedure, with or without conscious sedation. and with virtually no incision, certainly with the intravenous laser treatment. So we now have a comprehensive way to treat venous disease all in the office without the necessity of going to a hospital, and also without the necessity of staying off work for any extended period of time.
Comprehensive approach, what does this mean?
It means the ability to diagnose appropriately. It means the ability to treat appropriately. And it means also the ability to think outside the box. Like, for example, we use a herbal medication, which is sort of a no-no in terms of traditional medicine. We use something called horse chestnut, which has been shown over time to reduce leg swelling, reduce cramping, and we use that quite extensively. And we also advise a lot of vitamins, including vitamin C, for people who bruise easily. We use what we think has been effective over time, and we feel that we're very up to date with all methods of treatment.
Results oriented.
I've been in this area for more than 30 years, and my practice has been successful. It continues to grow. It wouldn't do this if I didn't have good results. Anybody who deals with the public has to be results oriented. Anybody who takes pride in their work has to be results oriented, and I certainly take pride in my work. I do feel that I give the best service that I can give, and I do think that that's of a superior standard.
Quality of life improvement.
We have many people who would kiss my ring, shall we say, in appreciation for how much better their legs feel and how much better their legs look. And that's very gratifying for somebody to come in and within 24 hours of treatment say, "Oh, Dr. Garvey, it's like you've saved my life. I've been having this pain, I don't know, years and years and years and years." And people have been poo-pooing, the doctors, the husband, "Oh, don't worry about it, da, 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 da." So then they finally get treated, and it's like, holding a ball game. So that's very, very gratifying. And, we meet that very, very often. So that's kind of what keeps us going.
What's the process? I mean, somebody comes in, they get treated. What can they expect?
Basically, the treatment with the intravenous laser, the effects are essentially immediate in terms of reduction of swelling, in terms of reduction of discomfort in that leg. For the sclerotherapy treatment, you have some immediate response, and largely it's a response in terms of symptoms, because you obliterate the vein and the symptoms go away immediately. And very often it's like burning, discomfort, and itching and pruritus. That will go away immediately. But the cosmetic aspect of it takes longer because of the fact that very often blood is trapped in the vein, and you have to go through a whole process of chemical change with the hemoglobin breaking down to hemosiderin, which goes from a purple, a bluish discoloration to a brownish discoloration, yellow, etc., until finally it fades. And that can take weeks or months, again, depending on the pigmentation of the particular patient. So that we do tell our patients that there's some immediate benefits, but by and large, a lot of the benefits that they're looking for will take time. The veins that we destroy won't come back, but they have a problem or a situation or a disease entity, if you will, which means that they will manufacture other telangiectasia or spiders or even varicose veins. Other veins may become varicose, and that could come up later on. So that it may be an ongoing process where they need to come back to see us in 6 months or a year or what have you to treat new veins that crop up, but they're not really recurrences. I do have limits, I do have expectations, and I do require expertise that I think matches mine in terms of what I am doing, because I think that my staff needs to complement me, and I think my staff needs to mirror me. We've had a lot of compliments on our staff, and I push them to work hard, and I push them to be accommodating to our patients.
Finally, let me close with asking you this. What does quality care mean to you?
Quality care means giving up my best. I'm very proud of my work, and I'm very proud of the fact that I stay up to date. I'm very proud of the fact that I've been in my field for a long period of time, so that I've accumulated a great deal of experience with different technologies. I know what works, I know what doesn't work, I know what has been tried before. I tend to know what's bogus, simply as a gestalt, so to speak. And because such and such a company or such and such a person doesn't have a track record. So that I'm able to analyze my field, I think, from the depths of my experience and from the depth of my knowledge, so that I can navigate it for myself and I can navigate it for my patient, and so that I can choose the appropriate method of treatment and the appropriate technology.
Dr. Garvey, thank you so much.
All right, thank you.